Okay, so this is the Board of Trustees, Platte County Health Center, meeting at 6 p.m., May 16, 2024. Let's do roll call. If you want to go down the line. Susan?
Present.
Kim?
Present.
Jeff? Present.
Zach, present.
Zach, present. And then anybody online? Just Cindy, that's it? Nobody else? Okay, so Chef Face busy. Okay, so let's do Pledge of Allegiance. Yeah, Pledge Allegiance
To the flag
Of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Excellent. Okay, has everybody had a chance to look at the, oh wait, we got any guests or public attendees? Everybody's usual crew, okay.
Yes.
All right, everybody had a chance to look at the past minutes, see if there's any changes, any concerns?
Yeah, good chance. I didn't see anything.
Nothing, everybody else is
No,
cool?
I
Do we have a
didn't.
motion to accept?
I move that we accept the minutes of April 18th.
Okay, Susan's, and then we have a second.
I'll second that.
Kim seconds. Any further discussion? Let's do a vote. Susan?
Yes.
Kim?
Yes.
Me, yes. Zach?
Yes.
Okay. All right, let's move on to old business. You can take over, Andrew, run your show.
Okay. Did I not have the right one? Just the agenda. It's okay. Sure.
That's right.
And hit the X there. Where it says all tools. Okay, so the first thing is the Swope Health Services Family Healthcare Clinic contract update. We still don't have the contract back from Swope, but on May 1st, the health department team met with the Swope team. We had a Zoom. Dr. Jamal kind of led that meeting. And she basically said there's three things that kind of take the longest for this to happen. And so that's where their focus is right now. The first thing is the EMR data migration. So we've started. Dustin's got in contact with our vendor. This happens, I guess, fairly frequently. There's an actual process to make all this happen. We're putting our people in touch with their people, so that's all going like it's supposed to, I believe.
Yes.
Then the next thing was, and I wasn't aware of this, but she explained that for every FQHC, they have certain services they have to provide. If they don't provide them themselves, they have to have an MOU or some type of written process to do it. And so that is really going to impact our agreement or our coordination with them regarding vaccines. They don't want to provide vaccines if we're already doing it, which makes perfect sense to me.
Resources. Yeah.
They want to partner with us so we can just hand that baton back and forth. So it's seamless. We're in the same place, but they don't want to do it. So that makes perfect sense to me. At some point, we'll be working, and Dustin, jump in if I'm getting any of this wrong. But at some point, we'll need to firm up an MOU with them so they have that documentation to send to HRSA when they are filing all that paperwork. The next big thing that they had, and I'm kind of thrilled that it was their next big thing, but was staff transition. And so I wasn't aware of this, but I knew they were very interested in speaking with Janice, and it's a two-way street, right? She has to make some decisions for herself, but I will say she is very, very committed to the patients that come here. So I ultimately don't know what she will choose to do. Maybe they can't make it work out, but right at the moment, it seems like both of them want to do something together. So that's really good. What I was a little bit surprised about was Dr. Parker has also been in conversations with them. She didn't get into details, but she did say she had been talking to them and they may be working something out too. So there's a potential that a lot of the care staff that our people are seeing will not change hardly at all. I mean,
You can.
well, they'll still have the people they're already seeing and there'll be additional people.
Right.
So it'll be a nice win.
I see.
I know the IT person, Thurston from Slope, will be coming on the 28th from 1 to 3 with his entourage. I'm not sure who all that is, but it sounded like it could be quite a few people. We'll be here. Our vendor for our IT equipment is actually supposed to be coming just to answer any questions that they may have regarding the infrastructure that we can't answer. And then I got an email today, Cindy Cogan got an email today from Jaron, the CEO's administrative assistant, seeing if he could meet with us from 1 to 3 on the 28th. And I said, well, you already have all your people here. And I know they want me on that meeting, so we can do before or after, but looks like the 28th might be. And what he's wanting to talk about is the contract. So whenever we firm that up, we will probably be a lot closer to things happening. They did have a few minor things he had told us, but for the most part, I think it's going to be just as we wrote it. So, which our attorney has approved, and when we read it, you know, it looked good to us, but that doesn't always mean it's perfect, but always feel good after the attorney reads it, says you need to shim this up or whatever. Dustin, anything to add about our status?
No, like I said, I put them in contact with Cerner as well, Oracle, and so we're getting the data information of how they provide us with that data, and then for us to how to store it long term after we go away from Cerner, like the costs and all that. So still working on all that. Like Andrew said, they'll be on the 28th. We have their clinic team coming here on the 30th. They'll be here and just be looking at facility, and we'll have Jen, our lawyer, here with us as well, kind of listening to what they need for the MOUs. So that way she can kind of help get that drafted up and have that prepared for them. So, but they're all very, very eager and excited to be part of this. So we're excited for it.
What was the original target date for them to start?
I think August 3rd, for the first full week of, I think when we spoke with them last, I think Dr. Jamal said that there probably would be like a weekend before the clinic opened up, that there would be, their business would kind of be closed down. So.
What time did they say they were gonna be here on the 28th?
1 to 3.
Text me like an hour before the meeting, and because I'm gonna be doing a bunch of stuff that day, but if I'm free, is that something that I can come to, or is this, you just want to do your thing?
It's secretive. I don't want you to know.
Well, I'm just saying, I don't want to be a fifth wheel, but I'm just curious. I've never actually met any of the executive people from Swope, so.
No, Dustin, will you make a note?
Yep.
To ignore Dr. Kingsley's request?
Make sure you put that in your calendar. Do not page or call.
Keep a low profile if you see them.
All right.
No, we'll text you.
Yeah, because I've never met actually any of the leadership, so.
I'm not sure how that day is going to shake out, but yeah, that one is going to be a group of people doing the tour. But if we can make or get Jaron to come that day too, that would be a nice way to meet kind of a lot of people.
Yeah, don't make him come on my account, because I don't know if I can
I
actually
will
go.
tell him, Dr. Kingsley
He
said, you
insisted.
better be here.
He insisted, yeah. Okay.
So things are moving. And I have something just to mention about that in my actual report, so I'll wait because it's written out so I can kind of read it. But things are going good, right, Dustin?
Yep.
As far as we know. The next thing is the reserve accounts policy. You should have a draft on your,
Draft on it.
in your.
This thing, yeah. It's this big draft. Where, yeah, it'll bite you. Yeah.
And the yellow parts in there are what has changed from the original that you got maybe 3 months ago, 2 months ago.
I think, didn't we discuss this last month a little bit?
Yeah,
Maybe it's
but
2
we
months.
did.
It
The
was 2
finance
months.
committee had met then.
Right.
So Dan, do you want to kind of go over the changes a little bit?
Sure. See, on the first page, this language was added by our legal counsel.
Yeah.
And it was basically to address those situations. I think that some government entities have encountered in other jurisdictions where one government agency that's receives a tax levy income from their tax levy has maybe a excess of funds, so they another entity in that same jurisdiction needs some funding, so they find a way to share the funding, and this basically makes that not difficult to do, but they can't like our let's just say the county commission, for example, cannot take money from the health department and give it to the board of services, I guess, without a lawful agreement in place.
Okay.
Then on the next page, we had some discussion about the funding of the building reserve account and the minimums, and maximums. And initially we had created a table where we took all of the major components of the building and tried to place a value on those to replacement value. But after legal counsel gave a suggestion that we might want to take the total value of the building and then add annual increases to that total value. So as the maximum, and then the minimum, we decided as a committee that the minimum amount should be 50% of that amount to purchase and renovate the building in 2023 plus 1% each year for, I guess, inflation. A little lower than inflation, but
So I believe Dr. Chape had asked when we talked about this at some length few months ago. He had really wanted to know, is there legal requirements for the minimum and maximums? Is there a maximum that's too much or a minimum that's too low? And that was really one of our first questions for Jen. And she said, no, there's not. That would be a little hard to, account for inflation on different things. And so there's just there's no legal requirement, but it is a good idea. And we kind of talked about this to make sure your numbers move kind of with the economy and budgets and that type of thing. So hence the 1%, it probably won't obviously
Won't be there for a while.
Yeah, it won't keep it up totally, but it will move it up. And so the other thing that Dr. Chape had asked is, what about if we have a catastrophic loss to the building? We're insured, but how much are those deductibles? How much do we need to have? And it kind of varies depending on what the event is, but it's anywhere between $5,000 and $10,000. So it really is nothing but just paying the deductible is not something we necessarily have to have in a reserve account. Just our normal cushion would cover that.
Right.
Sorry, Dan.
no, that's great. And then
So,
on
so I just want to clarify though. So so if we do the minimum amount equal, so we would still, let's say we had to, so the catastrophic thing I get, but we have this in place because we need to fix things. So let's say the water issue, let's say, and just trashes half the building or something like that. This would be enough to cover that, I guess. That's my question, I
It
guess.
should.
And then even though we would still send it to insurance.
Right.
So, yeah.
I mean, the reserve account, and as we talked about it kind of at length before, is yes, it's going to, it might be that parking lot that we talked, or the new parking lot we talked about,
Mhm.
which is probably going to be about a cool $1 million. The board has to go through the process to approve it, but we would be able to use these reserve funds not to have to borrow money, and we would have it to do it.
Okay.
I guess the only question I have is like the 1% annual increase. I mean, this is how hard is it to update these things later down the road? Just because, like, looking at that, like in a 10-year span, I mean, 10% increase is going to be anywhere near inflation rates. I mean, just normal inflation rates wanted like 2.5% or something. So like we're covering like half of that.
Right.
Planning wise.
Right. So really, it wouldn't be any harder than just looking at what we had. And probably, Zach, I think what would happen is we probably have had an occurrence of where we had to dip into the reserve fund, right? We'd be like, oh, Zach was really right back in 2024. We probably should have been increasing this a little bit. And hopefully we wouldn't get that far down the road. It wouldn't be 10 years, it would be sooner. But all it would take is a vote of the board to change it, and then we can adjust it. And we can adjust it now. I mean, we could, I think, she suggested 1%, but we could just say, we will increase that by whatever the IRS, inflation index says, and that could be a change. I mean, we could make that change now if that's the route we wanted to go.
So to me, it's more, what would be a likely scenario that you would actually be dipping into this money? So the parking lot's definitely one. But like I said, if you trash, let's say it rained and trash half the building, that would be an insurance claim.
Sure.
So I'm just,
Well, I guess it'd be for like things that wouldn't be typically covered by insurance. I mean, that's kind of where
well,
even homeowners.
the only other thing I could think of is, would this be also used to like buy a new building at let's say 20 years down the road, 30 years?
Possibly.
So that would be really the use of this money. And then plus that 1% over time, would that get you to the point where you could actually do that?
Yeah, so that would be where, I mean, housing market's probably like just in general, real estate grows at a rate greater than interest typically because you make money on real estate beyond what interest is. That's why it's a good investment typically. So, that's where, I don't know, I mean, 1% is a starting point too, where it's like we can plan on in the future looking at it in like a year or so and seeing where we're at.
Right. We're gonna review policies every year,
Yeah.
so we may be more smart in a year of knowing how to do this too.
Sure.
But
Yeah,
this is a starting spot.
That is a good point, that he brings up, though. I think the real estate values typically in this area double every 16 years. So you have to.
That's right.
Calculate.
But even if that was true, we would change the insurance policy more so than we worry about this.
Yeah,
To make sure that we actually have insurance policy that could cover in case this place burned down or something.
Yeah, we could look at appraisals too, because we do
Right.
get an appraisal every 2 years.
Yeah.
That's another way.
Because it's not just the amount of money, we want the amount of money it would cost to replace this.
Yeah, well, and that's where I guess that 50% and full amount kind of area would fall into play there, just because if the wording was appropriate, when we get reappraisals, so instead of it being building in 2023, it's just the most recent like valuation. And every year the county's gonna do that for us for the most part.
But we're not getting anywhere near this amount of money.
We don't have that.
Yeah.
Yeah,
money
so
in
this
every
is like
department.
way down the road.
Yeah.
Yeah, so
Future
that's the
thinking.
thing. But who knows is gonna be on this board. It's just we wanted to have it in writing just in case 20 years from now, the next board has at least something to look at and use as guidelines. So,
I mean, it'd be fairly easy to take out the 1% and just say it's 50% of the appraised valuation. And that would be and 100% of the appraised valuation, that would kind of move
No, I
us
see what
with,
you're saying.
I mean, we could do
Like
that.
I said, I was just trying to go through my head, what would be a scenario where we would dip, so it would, like you said, something like a capital adjustment, like a new parking lot or something, or if we wanted to buy a new building. That's
The
what this money
building
would be
the
for.
one thing that would cost the most money,
Right,
obviously. Replacing all the rooftop units in 4 years unexpectedly, that isn't going to get anywhere near these numbers.
Right.
It would be significant. If it's any, thing that's a disaster or whatever, that's going to be mainly covered, but there's still going to be expenses.
Right.
And then there may be improved. I mean, if you have a loss like that, sometimes you take that opportunity to make improvements too. So,
Right.
And this was suggested from our legal counsel, the way it is here.
it is, but I think she was just trying to figure out a way to make it incrementally increase, knowing that we probably have, I think that's the thing. Maybe you're saying, Dr. Kingsley, is we're probably over what we're actually concerned about. So the 1% likely to be okay. Is that kind of?
I just know, like she was saying, that we're going to reevaluate all these policies anyways.
Right.
But I would say maybe every 5 years, every 10 years, you're really going to sit down and crunch the numbers. Like, what is the new appraised value of this building? Right? How much insurance do we have to adjust? If we do decide to do a parking lot, what is the realistic cost? Because whatever they say it's going to cost, we just add another 5-10%. We just know how the game's played now.
And,
Right.
and realistically, insurance covers, I just had a conversation, a personal one with in my insurance company today, and how they're changing coverage of just different things regarding replacement costs.
Yeah.
Because they're gonna cover less.
Right.
So
Yeah,
you have to
costs
reevaluate
for
that too. Yeah.
Yeah. And so that enhancement may kind of be like you're
Yeah.
saying, just bringing it back to the standard we had grown accustomed to.
So I guess my takeaway from this is I don't have a problem with it. We're going to have to reevaluate this down the road anyway. I just think it's nice to have at least something on paper so that if we're not here, like I said, 10 years from now, that's a future board can say, use this as a guideline of what they want to do.
And I think on Tuesday, that was our discussion.
Right.
Yeah.
We want to kind of put down the base of what it should be, and that's what's accepted and, kind of what we've always done. And it makes sense. And then others could change it. They shouldn't, because we're all brilliant. Excellent. But I mean, having these reserve accounts in place is definitely going to make us much more financially stable. And if something happens, we'll be much better prepared.
Right.
And do we get appraisals every couple of years for insurance anyway, right? Yeah.
All right, keep rolling. Sorry to interrupt.
That's all right. It's talked a lot on that.
On page 3, the language that was added to section 7B4 there was provided by our legal counsel, just give some guidelines by which the board would access the reserve funds. And then on the final page, again, language provided by legal counsel on some different ideas that the board could use to utilize any excess reserves, any reserve, when the reserve balance fills up with maximums.
Can we stop on page 3 real quick? Because Susan had asked this question during our meeting. And 4B talks about, so the board has to, so A says the board has to make a resolution and say what it's for and what we're going to do. So we're going to build this parking lot that's going to add parking over here now that this clinic is going bonkers, and it's going to have a drive that goes away all the way around to our 3-bay garage, so we have great access and don't line people out on the street. All that makes sense. B says, that's great that you did that, but your standard is to pay that money back in 3 years. So you are spending $1 million on this parking lot. 3 years you should figure out how to make sure that is paid back to this account. because that tornado or that whatever may happen. It also gives you the option of, if you're not going to be able to do it in 3 years, because $1 million is kind of a tall order, you just have to put in the resolution what you're holding yourself to. So it might be, okay, we can't do 3, but this is a lot better than borrowing from the bank. We'll pay it back in 5. We'll pay ourselves back in 5.
That has to be.
You just have to put it in the resolution.
So the 3 years, that's a good ballpark number. That's what you guys kind of just thought would be good, or what we?
That's what the attorney suggested. We actually kind of discussed it back and forth. And on, HVAC units and most of the things we're going to use it for, super doable. $1 million parking lot, it seemed reasonable that the board can just decide what their payment plan is.
Right. But then we can come back and decide what we're gonna do. That's just. the
So
starting
3
spot.
years did seem like a reasonable starting place.
It's fine with me.
Dan, do you have any comments about that?
I mean, these are just guidelines anyways, and the board can decide really what they really want to do.
Mhm.
But it's nice to have them kind of at least face reality that this is what we're trying to accomplish here.
And it kind of goes back into who's going to be sitting in those
In
chairs
20
in
years.
15 years.
It-
Right.
What's the
Yeah.
base
What did
expectation?
they do back then?
Yeah, we wouldn't be saying 3 years of, when they think, oh, we have like 30 years to pay that back. No, it's a little more truncated than 30. It's 3.
And if not 3, why and how you gonna fix it?
And I think bringing that accountability
Right,
is important.
right. Okay,
Now back to your
Yeah.
last one. Sorry, Dan.
I'll give the board an opportunity to read through those. If you have any questions or comments about any of that.
Guess no cruises or
No cruises.
trips to Hawaii can be on there. Okay.
And I think this is really, whoever said it, I think maybe a couple of you have said it. If we get to this point, this is probably where we make changes to either this policy or look at our programs. If we are fully funding every program, we're meeting all the needs assessment tick marks. If we're doing everything we should be doing, then, and we still have an excess, then we need to look at not getting an excess. So
Mhm.
I don't believe
Doing
we're,
something to-
I don't think that's going to happen, honestly. But that's where we would be. That'd be a great place to be. We're meeting all the needs of the community. We have an awesome staff. We're paying them fairly. We're doing training. We're bettering everything. We're spending all this money to be a great health department, and we still have money left over. Awesome. Then we need to quit bringing in money.
so what is the time frame that we actually could get to that point? Is it like 20 years, 30 years from now? Or like, where are we if that for this to even happen? And that's including no expenditures, like massive capital, whatever.
I can't predict that.
I'm just saying, this is one of those things probably never gonna happen anyway, but
I wouldn't think so, because I think Zach said, every year stuff goes up. Every year, I mean,
Yeah.
inflation is outpacing, the taxes and the grants and everything that's coming in. I don't think this is likely to happen, but in case it does, we do need to not just be hoarding money.
that is
Does
not
that
the
make
role of
sense?
the health department.
No.
Okay, I like it. So do we need to approve this, or what do you want us to do?
I think Dr. Chape had the most questions when we
That's what I
presented
have
the
seen,
previous version. I do think we covered everything that he questioned.
You want to wait another month and have a chance?
No, I'm fine with it. I
Are
just
you?
wanted to
Okay.
point out that
Well, I'm
I
fine with it. I
believe
just
we
don't,
have,
yeah.
he had some great questions.
He can change it next year when we review.
Well, I'm
it.
just saying, has he actually seen these changes, or has he not seen these
He
changes?
no, he didn't see this. Because
Should we?
we didn't meet till
To
Tuesday.
me, it would be good to just postpone it till next month and let him have a chance to
Okay.
crack at it.
Sounds good.
That would, to be fair, yes, no?
Yeah.
Yeah.
Yeah,
It's
that's
fine.
fine.
I mean, it's not an emergency. We get this done like
No.
ASAP, right? So just, yeah, so,
Unless we're going to hit that maximum amount.
yeah. in
Yeah,
a
it's like,
month.
do we already have an excess? And you guys are like, well, we got some things we're doing.
Yeah,
$8
right.
million, just hanging out. That's why we're not paying off the building.
Okay, so put this on the agenda that we make a decision, yes or no, and that'll give Mike a chance to look at it. And give his 2 cents worth or whatever.
This month was just weird on the timing because normally the finance committee would meet before the packets would go out.
Right.
And this would have been in the packet.
Yeah.
It
Right.
didn't happen this time.
Right.
Because of health.
It was this week. Yeah, we met Tuesday.
Okay, next. I like it, by the way. I'm not against it. I just for fairness sake, let him have a chance to crack at it. So, all right,
Dan's just have to get back to where he wants. The next thing is actually going to be my report. So family healthcare, we actually had a fairly decent month, the best
did.
April that we've had
Oh.
in some time for Medicaid.
That's the-
Can you scroll down so we can see that next table too? Just a little. But even on the uninsured, we'd seen the most that we had seen in any April in the past 3 previous years. So those were going good. You can go.
so have we got any feedback why there's an increase? Is it just the word's getting out about this place or?
I'd say honestly, Dustin, if you want to interject, I think it was just an anomaly.
Yeah,
But
100%. It could be too, like, words getting out of this place, that we're a more convenient place for people to access care, that could be a part of it as well. I do know that a lot of different patients in the area do, like, they love our providers, so they come here and really want to see them, so that could be a lot of it as well.
But it's kind of 1 month. So I would be hesitant to draw any conclusions of, because,
Yeah.
the other months preceding everything for the past, since I've been here, has been pretty steadily declining or just barely keeping pace with the previous years, which were pandemic years where we were not seeing very many people. So far, I can't say that 1 month would convince me that we're seeing a whole bunch of people.
So it could be a fluke. Got it.
Could be.
All right.
One thing I do want to mention, go ahead and scroll down. So number 2, I kind of talked about, which is the family healthcare transition. I covered that earlier. But for those of you who know Janice, she has been she is very passionate about her patients, and she really actually just wants to know what's going to happen so she can probably bring some closure to herself and for her patients, so she can just direct them. This is what's going to happen. This is what it's going to look like for you. This is what it means. This is what you have to do to continue your care. We're going to take good care of you, and I'm still going to be here. I'll still see. Well, she can't say any of those things because we're not that far into this. And so every time I tell her, hey, we're not that far, we don't know, it's just frustrating, as you can imagine. Well, one good thing that happened, and she made a point to email Dan and I, and that was we had a young man who had started as one of our first COVID-19 testing nurses. And now we get to call him Dr. Trevor Purdue. But he just recently graduated with his Doctor of Nursing practice. And Janice was one of his preceptors and for 2 semesters. And then helped him with his research, and he is still working here PRN on occasion. I know he's coming back for our back to school fair in first week of August, right?
Yep.
But anyway, she's like, well, I guess there is one good thing because I got to be here to help him through that. And of course, she's very proud of him, as we all are. He's a great staff member. I'm sure going to be a great practitioner, but really enjoyed that. She's like, well, this was good. So she asked that I share that, and I think it is one of our success stories. You know, I know you have heard me talk many times about, I want to make sure we are growing our staff and nurturing our staff and moving them along their career path. And I have very little to do with this particular instance, but it is certainly exactly the types of things that I have in mind, is getting our staff to take that next step. And maybe they're not here serving the public, but they are somewhere providing good care to people. You can scroll.
So who else do we have coming down the pipeline to kind of continue this?
So I'm doing it technically, and then Dustin's doing most of the clinical work, but we have introduced you to Janelle Kraus, who is working on her
Masters.
MSN, MPA, or MSN with a concentration in public health. I forget, she's from Walden, and I forget how they term it.
She was here last.
She was.
Yeah.
And so that will be our, that's not an employee, that's an intern. But we just had a high school intern who gave us a presentation along with one of her teachers. So I would say that nurturing and professional development, that never stops.
Mhm.
A lot of times it's with our staff. Sometimes it's, outside people, but we definitely, as we move forward, especially through accreditation, there are whole parts of things that are going to be geared towards what you just said, is who are we nurturing and educating and getting to that next level. And accreditation, the things we have to do just are part of that.
I think it's always good to have a strong bench of employees or future employees or possible employees. And just in case things change or whatever. I'm not saying we're going to fire you today or tomorrow, but just in case.
The day after, I can go watch it.
But anyways, I think it's a great idea. So more the merrier. I'm all on board.
Well, and I think I've told you, Dr. Kingsley, when I applied for this position, we just didn't have very much, internally that had a lot of years of experience and, the education that we would be looking for. And when I retire, whether it be 3 days, 3 years, or 30 years, I want to have a really deep bench. I want to have at least 3 or 4 people that, I would always encourage for like my position to go outside, but hopefully what you're going to find out is that the best people for this position are sitting right in front of you.
Right.
And that would be my goal.
I agree with that.
Well, this is great marketing too for
Yeah.
Platte County
Right.
Department. We're going out to the community and offering the internships and the mentorships, whatever. That's great for our facility.
And it's very difficult now finding nurses. I know I saw where you got somebody hired for your position that was open, but it's very hard to find people in all nursing positions, and you're competing with hospitals and other areas.
And I think you know this, financially, we can't compete.
Exactly. You compete on a different level. You compete on working
Work-life balance is
situations.
where we
Right.
are attractive.
Yes,
And
there are other ways.
I started kind of a new thing for staff that are started this year, and that is their boss and I and whoever's in between, we're taking them to lunch
Mhm.
because I don't typically meet them. And so it was interesting talking to her and just kind of getting to know her, but everything she said was exactly kind of what you said. I could go
Mhm,
bank,
mhm.
but my situation right now, I have a little bit of luxury that I don't need to do that as much as I need to have some work-life balance.
Yep, correct.
And that's a wonderful thing
Mhm.
for the right person.
Yeah, so
And that's one of
employee
the joys.
retention.
We see a lot of nursing students coming through our program as well, like research, they come through here. It's was St. Luke's up here with their new name is now. They come in, like usually a couple different students each semester, and every single one of them loves this rotation. Like, you know, public health's kind of a cool thing. I might have to start looking into this more when I graduate. So it's like,
Mhm,
call me. We
mhm.
need it.
Um,
This is the meat of the matter. This is the one right here.
so down this hallway on the west side of the building is an exit to the outside.
Okay.
And as you know, we've gotten all kinds of rain, which is actually really good for my yard. I need the rain just to go straight down. If it blows from the west, it causes a problem on that side of our building. So you can kind of see in that picture that says water intrusion area. The concrete there is what, 22 years old now?
At least, yeah, yeah.
And so it has settled. And it's when the wind is coming from the west like that, it's blowing all the, if it's raining really hard, it's cooling back there and driving it in under that wall. That wall is made a certain way to vent, which is great as long as the concrete is sloping away from the building. Unfortunately, it's settled, so now the water's cooling and it runs right into Michelle's office.
Oh,
We can't just seal that up because it's important that it, any moisture in the wall be able to drain. And if you seal it up, then you can't do that. We are in the process of getting bids. My feel is that jackhammering up all that concrete right next to the foundation of the building and then repouring it and regrading it is going to be fairly expensive. However, we did get a great idea of just our normal remodel, and that is on the nurses station side, what we have done, because there's a bathroom in that area too, just like over there has one. We just put storefront, and so there's glass, another door, the exit sign and everything, and it just kind of then encapsulates that area so no water could get in there because there's essentially a wall.
You may still need to do a little bit of concrete work to make sure there's a slope at least from that idea out. Otherwise, you can run the risk of water coming into that.
And from
change.
there, from where that wall would be, it's fine.
Okay.
So
I
I mean,
just
you
don't want
can
it to
see
keep
the,
pulling because it's still going to settle.
right, but that's, 8 feet away from that corner, probably.
I measured it once, but
You guys want to take a look at it?
you know, I was gonna say.
Can we just go take a tour quick?
Sure.
Yeah.
So we'll see the damage and then
These
what you want to
pictures
go to the
great.
nurse's station to show what you want to do.
No, don't do that.
Oh, geez. Oh, geez.
Rules.
That was the president.
Oh, geez. Sorry about that.
Oh, we're good. We're gonna go see what it looks like. Okay. Oh my gosh. I think I did 40 or at least one of that there. Then I feel less busy. Yeah. It was less busy up there.
Yeah,
So that's where I get. Sneaky.
Jump way ahead of us like
Sneaky.
that. Okay, so do we have any like estimations of the cost and all that fun stuff yet?
Not yet,
I think that.
not yet.
Yeah, then
So what did we do to kind of fix all the water problems in the office room?
That was better for me to see it.
Really,
Yeah.
Dan and Frank went and bought a fan
I can't
and,
see it.
That's about it. So,
you know, made sure they could dry it out as quickly as possible and then put that top there.
Right.
And it really only happens when it's a driving rain from the west. If it's just a I mean, the rains we have gotten, a few of them, I mean, they were really coming down and it was a downpour
Yeah, that down.
from the west right into that area. If it happens during business, well, I guess it doesn't matter if it's business hours. I'll just have Dan go get 2 big umbrellas and stand there.
Stand there and
That would take care of a lot of it.
that's genius. That's
Hey,
thinking
there's-
outside the box.
There you go, Dan.
There's nothing
You knew
that's
that was
not
in
on
your
your job
job
description. You do
get
it all.
You get volunteered for a lot of
I
stuff.
do.
But short of that, I mean, I think the caulk helped, but we don't really know because we haven't had the rain as hard as it had been. But we'll get estimates. We'd love to see a fairly low estimate. The storefront actually isn't as expensive as you'd think, but have no idea. Dan did contact the people, the exact people who did that. Gave them the measurements. We just haven't heard back. So
And then also the bathroom is going to be up or changed over so we could use it. Is it an adult bathroom or is it a
I
kid?
think it has a kiddie toilet in it now, but
to
we'll
switch
do
up?
that at some point. I think the bigger thing for us right now is just getting that water issue taken care of.
Okay.
The next part of my report is the budget and where we're at. So at the end of April, which is the third of the year, we had collected 70.8% of our total revenue. Our expenditures for 33.3% of the year were about 30%. So we're kind of right at where we should be. And I think I've told everyone before, I think I even mentioned it last, a lot of bills are due kind of at the beginning and end of the year. So until you actually get to the end of the year, you don't really have a great vision. But if we were at 70% right now, I'd be really concerned. But we're hitting it kind of right where we should be. So we're doing good. That's my report, Daniel.
I do have one question about the money market account. So when you look at the money market balance, there was a significant change in 2022, right? And then since then, it hasn't been much of a change, maybe a couple 100,000, whatever, right? So is that just because of the money being pumped into it? Because it can't just all be interest, or is it? Or am I missing something?
So one thing you have to know is last year, we spent $500,000 of our savings because we had an unbalanced budget that I've requested the board allow us to do to take care of building expenses, so we didn't have to put it on the loan. So instead of the $5 million loan, we essentially had a $4.5 million loan. So that's why you don't see a whole lot of change. So we would have actually been probably $600,000 above. Rough. I mean, I can't predict exactly, but
Sure.
it would have been quite a bit more.
Okay.
We look at that interest rate in 22 and
Just huge
And,
increase.
yeah.
It's crazy.
Mhm.
And I think we're going to talk about it when we get to the finance committee, but this is atypical, obviously.
So as you are aware, a lot of our projects that we work on as a team, especially the management team. So I don't want to steal Taylor's thunder. A lot of these things, she's kind of taking a lead role on. So I'll let her talk about those, including the FAB accreditation and gap analysis tool. We did have recently have gone through and are in the process of going through open enrollment for our insurance plans. We talked about our insurance plans last month. So it's good employee benefit that employees appreciate quite a bit. Andrew stole my thunder on the high school intern. But it
You're
is,
welcome.
yeah. It
That's
is good.
because Dan made me show up 30 minutes early for the appointment.
We do have good partnerships with our school districts, and we've been doing something similar with Park Hill off and on for the last several years. And they're really good about recognizing us. They usually get a small plaque that recognizes us as a community partner. But the important thing is we are giving those aspiring health professionals an opportunity to see what public health is all about. And some of them, I imagine, are very interested, and others decide they want to do something else. So that is a great opportunity.
So, quick question for you. So, with the deferred compensation plan, the 457B, and then also the Midwest Public Risk with the health dental and stuff, how does that actually work? Do the employees make schedule an appointment with these people, or how does this actually work? How do they just come and do like a group presentation for everybody, or how do the employees know what the changes and what's updated, and how do they find out what's going on?
Yeah, with the 457B, there's a representative from Retirement Plan Advisors that routinely comes and just visits with staff. But we also, when they're hired, we let them know about that benefit. It's something I personally find very important and a great opportunity. So I really encourage, especially our young staff, to participate. But our representative with Retirement Plan Advisors is very good about explaining the product and why it's important to supplement your retirement loggers. It's a great benefit as well, but it doesn't come close to replacing your income when you retire. So it's important to supplement it, and it's a great tool to do so.
So they actually have somebody here, or do you have to watch like a
Yeah, he
video?
comes here, you can sign up.
And you can't actually.
You can sign up. Well, you can sign up online as well.
Right.
But he makes it real easy to do in person and guide you through the process.
He comes about once a quarter, and then he always has like your portfolio, if you're already investing with him, he kind of goes over that with you each time. Yeah, sometimes the meetings are a touch base probably for you, Dan, where it's like 5 minutes. Other times you have a lot of questions, and so like I had a lot of questions this time, so he probably spent like 30 minutes with me. But he's very knowledgeable about 457s and whether you want to do pre-tax or how you want to do that. And so like I learned quite a bit in my last meeting with him. So I didn't know there was a Roth version of that. And for me, it makes, like, just in my instance, it didn't make sense to do a pre-tax because my bracket will be lower when I'm actually collecting rather than now.
Mhm.
But for someone starting out, it very well may make more sense to do that pre-tax with the idea that someone who's 22 is going to hopefully be making quite a bit more money when they're 60 and they retire. So, you know, he takes the time to look at each person's particular situation and discuss that. So it's better than anything that you can get as far as a webinar or whatever.
Yeah, it's great. And the money that you contribute to that Roth IRA through the 457B doesn't count toward, like if you have another Roth IRA outside of that, it doesn't count towards your annual maximum that the IRS establishes. Now, there's probably not a lot of us that get to that maximum, but for those employees who do, it's a nice benefit. 457B is actually, the tax benefits are even better than a 401k. The main difference is most times, at least local government entities don't contribute to the 457B like a lot of employers do on 401ks, but we also have pension, so which a lot of private employers don't have. So we have good benefits package here, and I think that's another one of those pluses that we might consider working here because of the benefits. So.
And I'd say the other thing about a 457, which I don't know if I knew till recently, is that once you separate service, you can actually cash that out, even if you're not 59 and a half, and you don't have to pay that penalty. Now, if you roll it over into something else and then take it, you would have to, but the 457 doesn't incur a penalty like a 401, where you would take it before you're 59 and a half.
Okay.
And then I know in the past, we've talked about the merger of the Missouri Public Health Association and the Missouri Association of Local Public Health Agencies. That's continuing to occur. We're going to send it out to a vote of members in July. And hopefully by September, that will be completed just in time for the annual conference. And that's definitely something I'm very proud to have been part of.
So it's almost a done deal.
Almost a done deal, yeah.
Everybody's on board.
It'll go to membership, and I don't anticipate any huge issues, but all the leadership is all in, so.
Okay.
So really all I have, other than the community health ed report, which I was pleased with the appearance of this. Good photographs. We actually provided the money to purchase this simulator, this driving simulator to Platte County R3 School District. And I think the kids love it. So
And that was passed through grant funding.
yes, you're right, exactly.
I just want to clarify that when we say we provided it, we got money from the state for such a purpose and we passed it on.
So how's the drive thing working? Is the driver inebriated when they're driving, or how's it?
They do have setting.
Yeah, so that they see what it's like to not be able to make good decisions.
It like make the blurry and make the wheel kind of react differently and get like hard and stuff.
It's a good reality check.
It's pretty
But it is all electronically done. There is no beverages to.
We don't provide the bread.
Yeah, right.
But I'm a little concerned because Dustin always aces that part.
Okay, no,
It's like then everything's normal for him.
This is family support worker activities, which actually her direct supervisor is Tricia Rothweiler, who's also working as our social worker until the primary care is, transition is made. This is a report about the harvester distribution. You can see that we do get clients from Clay, Jackson, and Wyandotte, and I think we've had clients from Johnson County in the past, Johnson County, Kansas. Typically, it's about, I'm not going to calculate percentages on the fly here, but it looks like about 2/3 of Platte County residents that go through the distribution. But all are welcome. There's no income requirement. Department of Health report. They do have a little bit of catch up to do on restaurant inspections. Bailey has been helping out a lot with the transition as well, teaching CPR classes, and we have one of our health educators on maternity leave. So, Tricia's a bit overwhelmed. And then Kyle's mother passed away in April, so he was off for some time. But they'll get Carl. Any questions?
I think we already talked about all the cool stuff we were doing this month. We are working on social committee. We're trying to draft like a policy for how we participate in all of our social functions. I think we were kind of discussing at the manager's meeting, going more in depth over that before we approve any official policy. We did, as Andrew said, we have our meetings with SWO, working on those different work groups. We have our nursing students we've been precepting. We've also are in the process of looking at other EMRs as our contract with Cerner ends in January. That's up for renewal in January. we're looking at other options. Currently, we're looking at Patagonia Health. We're also looking, we meet on Monday with eClinical Works. That's actually who Swope uses. So we figure it might be easier to have like using a similar EMR that they have. That way it'd be easier for us to communicate our calls back and forth.
So Swope has what? What is it again?
eClinic Works.
Okay, so that's one of the choices. But so if we don't want to redo Cerner or Oracle, is just too expensive? Not, is it too wieldy or what's the issue?
All the things you just said.
So it's just not useful.
Yeah.
And then Patagonia, have you guys seen their product? Is it, what do you guys, is it?
I'm biased, so we need to continue to look at others. It's what I'm used to in a public health setting. I think it works really well.
Yeah, it's designed for public health. So
And then Swope has theirs,
Mhm.
and so we're gonna look at them as well.
So then I think those are our two main options we're kind of considering right now. And our biggest thing with those is billing, making it easier for our finance team and our clerks, being able to check like insurance as people come in for immunizations and things like that, because that can take, if you're on a phone call with someone, that could be like at least an hour call. So
Well, that and also if they're gonna be using immunizations back and forth, it'll be on the same record.
yeah,
So that
so
would
we're
be
looking
key.
for that too.
Yeah.
That's why we wanted to look into it at least and see what that one's like.
Yeah.
But I think both of them offered us online scheduling, and then like I think Patagonia does offer text reminders, which would free up our front desk a lot, being able to do that with our patients.
Is there any interfacing with other, when you're talking about immunizations and interfacing with other places like
The state.
the state, but like, a lot of folks get their vaccines at pharmacies. Is there any way to
CVS, well,
see that, look it up?
clinics, stuff like
Yeah,
that.
or CVS's or things like that. Is there any, I know that's a crazy thought. Okay.
It's well, some states do, all states have their own immunization registry. Show Me Vax is what Missouri uses. Unfortunately, not everyone's required to report into it. If you're a VSC provider, that has to be reported into it, but any other vaccinations, including those who are privately insured, aren't required to have that. So a lot of pharmacies and private doctor's offices don't offer that. So we're usually trying to contact them, get the records when they have a kid coming here for a shot, or someone wants to get like a travel vaccine. And then, like, oh, you're going here, have you had your Hep B or Hep A yet? Well, I don't know. It should be in my record. Well, we don't have it.
So because it's not required, it's not always in there. I can't tell you for the COVID vaccine, it was actually required
Those are
that people put it in there. So all those we actually have access to.
I just think a lot of hospitals now are moving towards a kind of like a care anywhere where they can access, like, I know at St. Luke's, I could look at KU's records. I could pull those and see if a patient had been there or if what they'd had done. It was a high level, but at least you could identify. So I was just curious if any of that's.
I know I would love like just a universal for in the States, like they had vaccine passports throughout a lot of Europe and other countries, and like the US just had like one solid program you could have that in there.
Yeah.
Can't make things too easy now,
I know.
right, guys?
I know.
When do you have to decide to have all this done before Swope actually is up and running, or?
No, we don't. Ours is still good until like Cerner renews in January, so we have until then to kind of look through all that before. Taylor and I have still been working on our Emerging Leaders Academy. We actually graduate from that here in a month tomorrow, I think. From tomorrow, we'll be finished that program. It's been pretty fun overall.
So you just had fun. You haven't learned it.
Yeah, no learning, just fun, complete fun. It just like
It's all that matters anyway.
Right.
get out of the office, not hear Andrew's jokes. Not too bad, not too bad. If you guys want to see me at next month's board meeting, I don't know why. That's basically a lot of what we've been doing. We did do the Parkview Health Fair. We tried to offer some free STI testing to them.
Okay, I did have a chuckle when I was going over that. So how do you actually do an STI booth or whatever?
So they actually had stationed up. So we had a table, we had little privacy curtains when we had to draw the blood, we could do that. We had urine cups pre-made, so they just had to go in the bathroom like next door to where they set us up at. So they'd go in there, get the specimen, and then bring it back, set it out for us, and then we would take care of it. From
I was
there.
just putting myself in the student's point of view. That would be so awkward.
And so that's why they put us in the very end away from all the foot traffic. So we had like little, like I said, we had the curtains up to where you couldn't really see who was going in there and dropping off specimens that way. So they had privacy. Yeah.
But that would be my luck. I'd go up there and I'd be, oh, hey, Jeff, how you doing?
I was just reading the sign, guys. I was just reading the sign.
Hi.
Like they used to like that one of the main buildings on campus, and like they all just be lined up, ready to go, and just be like walking in and out of the bathroom, just like. I think we had once had that volleyball team. All of them got practice. Like, all right, let's go get our STIs checked real quick.
Yeah.
All right, come on.
Times have changed.
How many people did you get through there?
This year, no one took us up on our free offer. Back pre-COVID, we actually had, I think we used to do about 50 students. They did move their location, so we used to be up in one of their upper levels. Now, the past 2 years, we've been down like a little lower cave level of theirs. So not as big foot traffic, but thankfully we had some of their nursing students this year precepting with us. And so they were advocating, like, no, they do great things. We need to get them upstairs again. Like, we love them here, and trying to advocate for us. And like their nursing instructors, like they're going to try to switch the location of it so that it is back upstairs where there's a higher foot traffic area, like next to the cafeteria.
And they'd actually told us we'd be in a different place this year, but we ended up in the same place.
Yeah.
So
Okay,
we'll give them one more shot. Dustin, when it comes time, let's do what we can. If you want to set up a meeting or
Be
whatever,
proactive.
let's see what we can do, but we can't continue to have
Yeah.
a big goose egg.
And that's what I told them. I was like, all right, this last year wasn't a very huge success. This one definitely was not. Like, we can't continue if it's
Because what was it, 2 last year?
We had 6 last year.
Okay, so, which is better than 0.
Better in this era, yeah. But and at least last year they had a lot more people coming through to where they're at least stopping by our booth and like grabbing condoms and like keychain that had like condom holders in them and things like that. But this year there were hardly anyone going through this fair at all. So it was pretty disappointing. I think that's really all that I have. Does anyone have any questions?
All right, so as far as accreditation, we hit a big milestone this month. So we completed our readiness assessment. So that was the step 2 of 7. So we had the meetings with all 10 domains, going through all of the things, determining what we have and what we need to work on. And then reviewing those and submitting those. So it was 117 staff hours this month spent on that. But we were able to complete that in 2 months, which from what I've heard is a record. So
Oh,
that's
awesome.
pretty exciting.
Congratulations.
Yeah.
Pretty cool.
So
Did you get a medal?
uh,
Or do I have to give you
you have to give me one. I'll take a certificate too. That's
one? I made her a certificate for getting her car parked within the line.
It's baby steps.
And that's-
Really.
Small achievements.
Yeah. So now our next steps are going forward with documentation, working on policies and procedures. We've also done the VMSG dashboard. We've had 2 trainings for that so far. And I think that's the accreditation stuff. Is there any questions as far as accreditation? Anything else you want
Good work.
to add? Great.
At some point in the very near future, we will have the findings of the readiness assessment to share with the board, but that's not quite ready yet.
And then our plan going forward, then we'll have a year for documentation. So we just need to go through and either find the things that we already have, and then work on the things that we need to update.
Okay.
I know we probably have said this before, but just to refresh my memory, how long do we think it will take to get to this? Where we meet to be
Yeah.
accredited?
So it's a good question. I mean, they say it can take anywhere from 18 months to 3 years. But I think we're hopefully going to be on the lower end of that because right now we have a year for documentation, but then after that we'll have 6 to 9 months for them to review the documentation, and that will include a site visit, at least 1, potentially 2 site visits. from the FAB committee. And so it kind of just depends on how long
Hopeful would be
something's-
maybe 2 years. Or sooner than that.
We're hoping sooner, but realistically, it'll probably be
least two.
about 2 years.
Okay.
And when Taylor says, you know, the documenting part, a lot of that is actually creating and changing stuff to meet the standard. So
So you
it's
probably
more
doing it
than
in some
just,
way.
it's a lot of work.
Yes.
Yeah.
And trying to bring everyone along. I mean, just going through the readiness assessment, we're clearly not all speaking the same language. We're learning, but what one thing means to somebody, what a enforcement action means to one person isn't the same as what that means to another. And so I think when people say they really improved from going through the process, I know one of the things that you just have to improve on is communication and speaking the same language between all the different people in the health department, because we are not doing that as well as we can be. And I think we've already started just by having those meetings and discussing the stuff back and forth, having the things from the Public Health Accreditation Board that explains what they mean by certain terms. And then we have, and I'm one of them, but some staff that are pretty stubborn. And so, you know, being able to,
Set in their ways.
exactly, but being able to kind of bring everyone along to have those frank discussions is actually frustrating, time consuming, but ultimately really rewarding. And it's going to make us better so we're all on the same page later. But it kind of has some growing pains.
Right. And there are some like heavy lifts on things that we need to do. So like one will be like strategic planning. So that will be a big chunk. And then we have to be updating the community health assessment, community health improvement plan, different things like that. So we have a lot ahead of us, but I think that we have a good dent into it, and now we kind of know where we're at.
And I will say that a lot of this will be done at the staff level. And so there is some heavy lifting, but I do want to just warn the board now that things like the strategic plan is going to take board participation too. So, I mean, we will try to structure that to make sure we are, you know, careful about everyone's time, but there will be things that we will be asking you to come to where it'll be a strategic planning meeting, and we'll be doing that together because we're not separate. I mean, we ultimately are all one department. And so, you know, the leadership needs to be included on the direction we're going. You know, we can suggest things, but I think that part, there'll be some great discussions, but it will be some time too.
And just mention the Emerging Leaders Academy. Also last month, myself and the epidemiologist attended the Mobilizing for Action through Planning and Partnerships training. So that'll give us kind of like tools and resources and guidance for how to do the next community health assessment. They've kind of updated different things. A lot of things are moving towards focus on equity. And so that will help us with that, the chaw and the chip for the next cycle. Then there's the communicable disease report.
So I have a question about the Rocky Mountain spotted fever. So it was actually diagnosed or was it suspected?
For the Rocky Mountain spotted fever, I believe it was not actually determined a case. I think it was just that someone had, an investigation was done. I think it was just a suspected case.
There you go. You can be honest too.
I'm gonna try to not be one of those.
Any other questions on that?
Okay.
It looks looks like it's to you, Susan.
Oh, okay. The Finance Committee met this past Tuesday, May 14th. And we had several things on the agenda. One being that we've already talked about was the reserve accounts policy that we updated. The other issues that we talked about was, and you have, you should have this paperwork on the adjustment to principal payment schedule for lease purchase. I guess we do the check every month and send that to the bank, but the mail system has been slow at times, and so they have received it. My understanding is that a later time, they haven't charged us any late fees, but there is some issue with the mail service. So we're recommending that it be a debit
Automatic withdrawal.
automatic withdrawal.
Did they not want us to do that ahead of time? Or?
You know, they didn't not want us to do it. They just didn't. I mean, now they've offered to do that for us, so we'll be taking them up on that.
And what will come out will be not the 22,000 that we are writing every year or every month. It'll be the $17,025.35 that will come out. So how do we get that interest, pay that interest a little quicker? And then this is the form that I think Dan has put together on that. So if we, if no extra principal payments, the loan would be paid off in 14 years. But if we do an extra monthly principal payment of $4,974.65, it kind of shows there we'd save $197,590.35 with the interest. And if we did just a flat payment of interest in January,
The start of the year.
the start of the year, where we have additional funds, usually is when, not additional, but we have our biggest probably bank account partially in there. The interest that we could say would be the $214,719.90.
So Andrew and I were talking about this when we met.
Right.
So basically the difference is going to be, do you pay the extra money each month? Or can we just give it as a block sum at the start of the year? And then what that'll do is actually drop the principal balance quicker. And then the interest that accrues for the rest of the year is on that lesser amount, as opposed to just the lesser amount with each gradual month. So it seems to me, and the numbers actually back that up, that that's the better way to go. Yeah. Now, the question that I asked you though is they don't want us to pay the whole, they want us to make our monthly payments, right? So what was there like a penalty or a fee or anything, or what was their?
We're contractually obligated to make that payment.
Correct. Until the principal balance is gone.
Right.
Correct.
So monthly. I mean, basically, we signed a thing that said we would make monthly payments in this amount.
Right.
And they're not budging on that.
Which is fine. I mean, we'd do that anyway until the principal balance is gone. So I get that. But I didn't know if they were going to penalize us for dropping the cash at the start of the year.
No, there's a no prepayment. It says we have no prepayment penalty. And so we had $3 million, we could pay it right now.
Right.
And not suffer any problems.
It just seems to me over time, you're just going to be kicking the tail out of this loan if you do it that way.
Mm-hmm. So the memo basically suggests that we adopt that January approach of taking all the principal, paying it in a lump sum.
No, the extra principal.
Right,
Yeah.
the extra principal. But for this year, taking all the extra principal for the rest of the year and including that in the June payment.
Mm-hmm.
So we can go ahead, instead of just waiting till January, well, let's go ahead and do that.
Yeah. So the only drawback of doing this is, like you said, we have this chunk of money at the start of the year, we put a lump sum down. But what if there's some kind, which I doubt will happen, but what will be the financial ramifications if there's money needed later in the year for something else? We already had this set aside that we were gonna spend this money regardless.
It's in the budget.
Yeah, so there should be no
There should be
issues.
no, correct.
Yeah.
Because we're writing, what is it? I think it's 22,000, so, yeah.
So that there should be no drawback whatsoever for doing this, except
Because it's almost 5,000 less that we're sending monthly than we were paying monthly. That makes sense.
and then if we are late for payments, they can't give us any kind of late fees because we should already be way ahead of the ballgame anyway.
Well,
For
it's
that.
into the principal, it doesn't count for those payments.
Yeah.
So when you write that check, it has to be principal balance only. Gotcha, okay. So they are kind of really stickers for the
But-
rules.
He's also fine with the ACH. They're actually going to set it up. They're going to take care of it. And so we won't have any charges or fees. So it's a win-win for everyone. They get a timely payment. I will ask that we put it as far early as they're comfortable with. You know, so
I think it's a really good idea.
Yeah.
Who actually thought of that idea? Was it you or Susan? Who thought of this idea?
Well, I think.
It wasn't the-
Well,
the
I don't know,
bank.
was it the bank?
I don't think the bank- I don't think- I don't think it's the bank.
It's like, how can we get you out of paying us more money?
The mail service made the,
I don't know if Dan and I
the
talked
proposal.
about it, but I do remember thinking, because I wanted to just pay, like, why don't we just pay the whole thing? Like, we have all this money, we could make all the payments, including our regular payment, the principal extra, we could do that on January 1. And not real, I mean, we know we're obligated, we have to pay it, we have the money. And so I called Kelly or emailed him and I said, can we do this? And he said, no. And then I'm like, okay, but well, you can't tell us what we can do on the principal. I know that's in there that you can't tell us. So how about we do that? So I'm sure Dan and I talked about it. And he made sure that my plan was solid. So usually he's kind of my Jiminy Cricket, making sure that, are you sure that's the right thing? What if, kind of, I don't exactly remember, but I'm sure it was, what if something happens or what, well, it's $60,000 over the course of the year. We're trying to have these reserve funds. We're trying to not be in a position where $60,000 is going to put us in the poorhouse. If that's the issue, we have bigger ones. So I think we kind of have
Yep.
talked about.
I like the idea. So how do we move forward with this plan?
So there's motion
there's
language.
motion language down there.
Okay, so who wants to make the motion? Well, first of all, are we done with the discussion or I don't want to go fast forward too fast.
I think so.
You're running, Sean. I'm not running, you're running. Sean. Tell me what you want.
I'm
You're fine
good.
with it?
I've discussed a lot.
All right, so do we have a
I
motion then
discussed
for this proposal?
Yeah.
Okay,
I move to make move to make
The entire.
the entire scheduled additional principal payment for the fiscal year in January. And for 2024, the remaining scheduled additional principal payment amount for 2024 will be made in June.
okay, do we have a second?
A second.
Okay, any further discussion? Okay, let's vote. Susan,
Yes.
Kim,
Yes.
me, yes, Zach?
Yes.
Okay. That was too easy. Okay, what's the next issue?
The next issue is, you have handouts for that, is the employee meal and mileage reimbursement.
And I can talk
Yes,
about
thank
that.
Katie, please.
This one. So currently, we do not use a per diem. So the Government Services Administration actually has like a per diem for their staff when they travel. And you go travel wherever you're going is a certain amount. So if you go to New Orleans, that's more expensive than Kansas City. If you go to New York City, that's probably going to be more expensive than New Orleans. And there's a whole chart, and Dan actually made this up and put it in your paperwork, but it kind of shows the different per diem amounts. We have $45 for the entire day, regardless of where you go. So if you're going to a conference, I think the preparedness conference was in Boston, Cleveland. So it was over towards the East Coast, still $45. Pretty sure she was probably not able to eat for $45 for 3 meals. Now, that really is unfair to the staff. And the other issue currently is everyone has to provide receipts. So to get that $45, it's not a per diem. So you actually have to keep all your receipts. And then when you come back, someone in Cindy's shop has to go through all your receipts and count them up. Talked with the finance committee and really just kind of recommended we just use the GSA model. It's established. If, you know, for instance, Dr. Kingsley, you're going to Nashville, whatever that is what it is. You know, I believe on travel days, it's 75%. So if you're leaving on Monday, you're going to get 75% of the per diem. You're coming back on Friday, you get 75% of the per diem. The other days, we're just cutting you a check for whatever it says for Nashville.
So basically, whatever the amount is, the expectation is this is your cash, whether you spend it on food or don't. It's not our problem. You know,
Right.
no receipts needed. This is just the expectation that you would need whatever that amount of money is.
You
And it's up
decide
to you. How do you want to spend
right. You decide to eat peanuts that you brought from the airplane and water. You're going to make whatever that money is because you're not eating. You decide you are going to have escargot and caviar. You're going to be footing the bill for that extra several $100s.
You have the first amount and then, yeah. So is the $45 what you're talking about, is that something that we're gonna have to increase? Because I can guarantee you, I travel, $45 doesn't do squat these days.
That's right. That's why we're changing it
Yeah.
to this.
So it basically, we will just adopt whatever the Government Services Administration says.
But even that sucks too.
Well.
I'm just telling you, just the reality,
I
full hard
was-
truth.
Yes.
When I travel,
know.
this is what, according to
But
this,
it's
this
better than the $45.
so what I would do according to this is I would skip breakfast. I would probably pay for lunch myself. And then I would have this lump sum to hopefully pay for whatever dinner's gonna be. I mean, that's the cold reality.
So, I mean, personally, like I've worked on like per diem rates and stuff like that. It was a few years back now, but not so distant that like, I mean, I got $20 a day for meal money and like A-ball, and that was like, I did just fine on that. But you know, it's something too where, I mean, you know, if your expectation to, I guess, is to meet other individuals in the field, you know, sit down and have a meal, it's going to be more expensive. So I think that, you know, I don't know, you know, what it would necessarily cost.
Well, this
I
looks
just
like
went
what
to
they say for
Nashville
lunch.
a week and a half, and
It says $20 for District Columbia for lunch, right?
Sure.
Where are you gonna spend $20? That's like McDonald's is 12 minimum.
Yeah.
So that's not even a sit down restaurant.
New York would be a hot dog on the
Yeah.
on the street.
Mhm. Yeah.
But it is a standard. I guess that's what we're kind of saying, and that we follow some type of standard versus just some random number that's out there.
I prefer I mean, it'll be good for an accounting purpose as well. It makes accounting for things easier for the employee that's traveling.
Mhm. It's far
well,
easier than,
Here's how much you're getting up front. Yeah, go beyond it, you know, it's coming out of your own pocket, stay under it, and, you know, when you get back, you get
Is
that.
this updated every year?
Extra hamburger.
Right.
There's not major changes,
But
but it is updated.
That's
And
easier
that's
for
the
me than
beauty is we don't.
what
have
I've
to do-
experienced in my jobs when I've traveled is
We just,
keeping track of all the
update,
receipts.
you know, we're.
And
I lose a receipt for
yeah, it
myself
just
too.
really stinks, yeah.
Travel credit cards. So that you just have
9%
it on file.
inflation.
Yeah, we used an app on
Yeah.
our phone. That's what
That's
we
gonna
did, but
depend-
Yeah,
still,
we got an envelope of cash, and it was like your money for the trip, and
Yeah.
so you were counting pennies.
yeah.
So, okay, so what is it? We'll just do whatever this is?
Yes.
But we don't have all the cities. So let's say they end up going to
Sure.
Pittsburgh. What are you gonna do that?
Yeah, there's a website
This
that
is just
shows
an
it all.
example.
Okay, so
This
that,
is an example
There's a
because
full list, huh?
Dan rightfully said, you know, the board's going to ask questions like, what do these different amounts look like? So he picked
was really
his
good.
favorite places to go.
He basically made a wish list. Huh? Okay.
Or he picked the cities he'd heard of.
He was real excited.
I
It was
You
Kansas
only
City.
know like 8 cities.
That's it, yeah.
So that's just a sampling, but you kind of get the flavor of expensive and less expensive.
does that seem good for the employees? All agree this is a good idea. They like it.
Better than what it currently is.
Yeah, I was gonna say
Alright.
versus $45.
And then you
Yeah.
got my,
We'll
you got my
track
take
this.
on it.
Yeah.
Fine with it.
It's still, you can still debate it.
Yeah, I think that's
At least
kind of a
it's-
loaded question.
Mm.
I don't see anyone complaining about not having to track every receipt and
Yeah,
having to
that'd be
call
the
back
best
to
ever.
a restaurant
That's.
that you're no longer in even the same town to try to get a
Yeah.
receipt that got washed in the washing machine because you were out in your shorts after,
Yeah.
I mean, it's just a
So
hassle.
that's the very much positive of it, it's no receipts.
And I assure you, that was probably done on work time, that tracking down that receipt. So it's actually going to save us money.
Okay, so the next question I have for you then is how often does this actually happen that we have people traveling to Nashville or whatever? Is this like a pretty frequent thing
Every year, multiple people.
to,
And,
to whatever?
Different
you know,
conferences.
professional development is something that we haven't always been pushing, and it is something that's a priority to me.
Okay.
And I know for Dan just passed me a note that said, you know, this year we had incentive funding and we nailed everything except being accredited. I probably stole Taylor's thunder again. But this upcoming year, one of the things that will be qualified for it is sending staff to the National Association of City County Health Official Conference in Detroit. That's one of the things we'll get money for. That's one of the things the three of us are scheduled to go to. And it's probably something staff hasn't been to for quite a few years.
Since
probably.
it was in Kansas City, yeah.
Yeah, so that was at least, yeah, it was a while ago. So
So like ballpark figure in a year, like what would be a typical expectation for like your expenditures? This, like historically, is this something that's like tens of thousands of dollars, couple $1,000s a year typically?
probably
10,000 might be.
10 to 15 for everyone who's traveling. And that's probably going to include Dr. Kingsley and Dr. Chape's trip to Nashville. So,
I'll see it up close in person.
I mean, I'd say definitely under 20. And we have it budgeted, so I looked, I did not, I don't remember. But we weren't going to exceed our budgeted amount.
I mean, it seems reasonable, and I mean, obviously, if we implement this, be able to look back on it as well in a year or so, and if it blows things up, then make adjustments, but it doesn't seem unreasonable.
Yeah, I think
That's a standard.
when we looked at this, it just appeared that staff were taking a beating on, you know, they're not enthused to go because it's
No.
costing them money.
I understand that.
I mean,
Yeah.
and
It's still
for
not
some
gonna fix
people, it's
everything, but
required
it's-
training that they have to go to for their position.
Sure.
So our preparedness person, she was required to go to Cleveland, right? Not Boston, but required to go to Cleveland. Oh, and by the way, you're required to basically pay for part of your own trip. Now, I know, depending on where you're going to eat, but at least this is a standard that we can say, well, this is what everyone else uses.
It's called Domino's.
Exactly.
McDonald's. All right, do we have a motion then?
Yeah,
You have to read it verbatim.
Motion to move to accept the Government Service Administration or GSA per diem model as the reimbursement rate / procedure for employee meal reimbursement during travel and to amend mileage reimbursement.
We haven't discussed
We
the
haven't
second.
discussed that second.
So
part.
just.
Oh, do we need to wait then?
Sure.
We can.
Okay,
We
well,
can
just
or
do
we
it
can
all,
do-
just do it all
okay.
as one. Okay, never
Okay.
mind, take it back.
Okay.
Do your thing.
The second thing that we would like to update, and that we talked about was the mileage reimbursement policy.
And do you want me to talk about?
You
that?
want to talk about what, you can talk with the present one and what we are proposing.
So currently, and I'll just use the example of me going to Columbia for one of my many meetings or Jeff City. So currently the policy is written, and this is different from any other place I've worked, is because I work 30, or the office for me is about 35 miles away from my house. If I drive from Blue Springs to Columbia, the only mileage, I don't get to count my actual miles that I drive. I have to count my miles and then subtract 70. So I'm not getting the miles that I have to go to for a required meeting. Because at some point it was perceived that there was a benefit. Now, doesn't matter if I, on normal days, ride share with people or take public transit, because I'm 35 miles away, I don't get to claim that mileage. That seems very unfair to me. It's been an ongoing issue for several staff. And it's, like I said, just not how typically any other place I've worked has been. It's always been whatever is least. So if it takes me further because I live further away, I'm only going to get the amount that it would take from the health department to go to someplace. So let's say I had a meeting in Des Moines. I would only get the miles from our office to Des Moines. I wouldn't get it from my house. But if it's vice versa, I'm going to save money. Part of the problem is we end up, you're like, oh, well, you would have to drive that anyway. Well, people can play, some people are bitter about that. So they actually drive here, drive through the parking lot just to be spiteful and to start the clock of when they are leaving here. That's kind of ridiculous. I get it, but I also, in my empathy for them, I get the kind of ridiculousness of the rule. We can save time and save payroll time, save mileage still, and just let people get what their actual drive is. And that's kind of what we discussed.
So you would say, whatever your address of your house is to the final location, that's what you're gonna get reimbursed.
Right.
And the
essentially.
return trip.
And the return trip back. Now,
As
that-
long as it's less
Less than what it would be.
from the health department.
in case, the conference is on the other side of the health department, you're going, it's fine.
If it's more, then you don't get it. You
Right.
get what it would take.
So
to
now,
get to
so
work.
when would this apply? Only for conferences or something, or what were the other things?
For all,
Or any travel.
Anytime.
anytime you charge mileage.
So would that be then, let's say you live where you live and then you went to something here in Platte County, but you didn't come here? Would that be reimbursement that, or would it still be from?
From here.
It's going to be, so if I go to Platte City.
Yeah.
All I'm going to get is from this
Here to
building to
Platte
Platte
City.
City.
Yes.
Now, if I lived in, what's the little town north of Platte City?
Like Dearborn?
Cannon Point.
Or something,
Farley.
yeah. Okay.
Just start naming.
None of those, it's like.
Name
immediately-
that.
Waldron,
Well,
INT,
Tracy.
Aldrin.
If I lived in Tracy,
Tracy,
Okay,
there you
Tracy, that's what he said.
If I lived
Okay,
in
you
Tracy.
win.
then I'm only going to get the 3/4 of a mile from Tracy to that meeting in Platte City. Here, I'm living in Blue Springs, I'm only going to get from this building to what's in Platte City.
Got it.
And that basically, I
Basically, your drive to work, you don't get mileage.
Right.
right,
That's fine. Okay,
but you don't get penalized either.
Right.
and the 67 cents, that's the going rate. That's what I get paid to.
That's the IRS rate.
Yeah.
Yeah.
Yep. Okay,
Okay.
now we can do the whole thing. So we want to start over and
Okay,
give the
go
whole spiel.
Sure.
He has practiced.
Yes.
I move to accept the Government Services Administration GSA per diem model as the reimbursement rate / procedure for employee meal reimbursement during travel and to amend mileage reimbursement to allow reimbursement between an employee's home and off-site work location.
Okay, do we have a second?
I'll second that.
Any further discussion? Okay, let's do vote. Susan?
Yes.
Okay.
Yes.
Me, yes. Zach?
Zach, yes.
Okay.
And I don't think we had anything else from the Finance Committee.
No.
That was a lot.
So we actually
I mean,
went long, we went for like an hour and a half, I think. Or
It almost takes that.
Yeah.
One thing we all got homework too. So one thing we will be doing. I don't know if we'll have suggestions or not. But Jim had sent us this, which is Missouri Public Fund Investment Guide. So it talks about different ways that are acceptable for public entities to invest their funds to basically get the best return on whether it be our reserve account that we were talking about or just our operating funds. We're going to read this. We may or may not come back with any recommendations for the board, but it is interesting that there are options. And over the years, Dan, if I understand correctly, we've done different CDs and different things that have, put that money in something that would grow more rapidly for some of the funds that we knew we wouldn't need right away. But we don't know. So
And I think we were gonna make this available, weren't we, to the board?
I think we were going to do our homework first and then
then-
share it,
Okay, all right.
but it's not a secret. Cindy Cogan, can you please send the Missouri Public Fund Investment Guide out to everybody?
Then they have it. You wanna read it, great.
So the money that we would have in the reserve funds wouldn't just be sitting in a bank account somewhere. The idea is that you want to take that money, invest it, so that we're not
Well, we
making.
don't know.
We don't
But that's
know.
what I'm saying, but that's the concept with what that would be.
There might be an option.
Okay.
And we're going to be, we kind of discussed it, whatever it would be, we'd be very risk averse.
I was just gonna say, so the interest rate right now is on our money market's 4.7, whatever it might be for these funds. We don't know how long that interest rate's gonna stay that high. It may come right back down. So having it in an account where you're actually investing, it might be the better way to go, but then the stock market could plummet too.
Yeah, so I think we're probably shy of,
Market dependent thing.
Right.
yeah, we would probably be
Would
something.
treasury bills be part of that? Cause you
Right.
can do a treasury bill for like 3 months now.
Yeah,
get a
and it all kind of
5%.
depends on the interest, right?
Well,
Yeah.
the ability to access the funds
Right.
as well, because a lot of CDs, if you pull it out, then it's like
Locked in.
basically you wasted any interest you.
Yeah.
accrued back in
Prove
time.
it. Yep.
And if it's an emergency fund,
Right,
not really something you want to have to risk.
so it'd probably be a hybrid of, if we were going to do something, we wouldn't do the whole amount. We would do like whatever amount we thought we could sneak by with, not accessing immediately. Even like on our, we're having an operating reserve and a building reserve. We know that for our operating reserve, while we might need that money over the course of the year for an event, we wouldn't need it in the first 3 months or maybe the first 6 months. So maybe what it is we don't exceed 6-month treasury bills, knowing that we can access it. I don't know. That's kind of what we're just.
I'm thinking high risk Bitcoin, but
So Bitcoin's always pretty good.
Okay.
just throwing it out there, just talk amongst
I don't
yourselves.
know about voting for that, but okay.
Kim's a hard no.
Come on, start doing that.
Okay, financial report, Cindy?
Anything this month, unless anybody has questions on bills.
I saw you had to pay that Kingsley dude the mail board packet thing. $36. That's done. I got it though. So
It was a gold envelope.
was it? Yeah.
I got to go to the airport to the FedEx.
Is that where you went to get it? Okay, maybe. All right.
And I had no idea that it was there, so that was kind of fun. Just need to move to pay the bill.
Okay, so do we have a motion to do that? Actually, you know what? I'm here. I make a motion to pay the bills. Do I have a second?
I'll second it.
Kim seconds. Okay, do any further discussion? Okay, Susan,
Yes.
Kim,
Yes.
me, yes, Zach.
Yes.
Okay, so we paid the bills. What's next?
Fee resolution,
No fee resolution.
good.
That's easy. Okay.
So now it's into new business and Mr. Chairperson, I have a request.
Go for it. What's the request?
The third or second item is a presentation from Taylor regarding emergency response plan for avian flu. Dr. Chaffee had asked about that last month.
You should probably see it.
If you don't mind.
Yeah,
We
we could postpone to next month.
could we table that? to
Yeah,
next
that's
month?
fine.
I
Yep.
was gonna suggest that, but I thought you'd say no.
I like to be unpredictable.
Okay.
So then we need to make an agenda on Dr. Chaffee's all late.
This is Dr.
Late.
Chaffee's corner.
Just put that on there just for his benefit. Because we have to go, he has to look. Yeah. And then whatever the draft thing, that has to be on there as well. So yeah, he'll have his own little special agenda item.
I think
All
it'd be kind of fun to make it like really pointed out on the agenda too.
Yeah, I'm totally fine with that. Okay, so yeah, we can table that next.
The next item on the agenda is the amendment 1 to the city's readiness initiative contract with DHSS. And this is a contract we've had for years, probably since about 2003, I think.
After 9/11.
After 9/11. And it provides funding in part for our emergency response planner, a very small part, but it also helps us prepare with other entities in the region, in the city region, to dispense prophylaxis if necessary within a 48-hour time period. The contract amount is only $12,327, but every little bit helps.
What is the actual prophylaxis?
What's that?
So what is the prophylaxis?
I guess it would depend on the pathogen.
Yeah, but is $12,000 gonna do something like that?
No, no, it just kind of helps us prepare.
So it's all not, so that's really for the planning part, so it just pays part of her salary and pays for part of staying up on things like the flu and,
Yeah.
but it used to be a lot more money. And over the years since 9/11, that money has been depleted. So
Theoretically, the prophylaxis would come from the strategic national stockpile, the national strategic national stockpile, which has to go through the state of Missouri. And but just preparing that for that whole process is part of it.
Like setting up distribution centers, things
Exactly.
like that would be on us, the onus for that, but
Right,
getting whatever the prophylaxis would be up to the federal and state.
right. And Missouri, unless something changed, is what they call a pull state. So we have to request whatever we need from the state of Missouri. Kansas, I think, is a push state, so the state just sends it out to all the jurisdictions. But anyway, a lot of ins and outs are kind of interesting, but also
And I don't think we've had an exercise for some time,
It's been a while.
but it is a very interesting endeavor because they have fake boxes and it's trucks and you
I
roll to the
participated in that.
location and you
Skittles.
pick it up. And,
Skittles.
you know, you usually have volunteers that come through your site to dispense to, and it's,
Yeah, and we actually got during the COVID, the mass vaccination site, we really got to exercise it. And I think we did a pretty fantastic job. Dustin could probably give you exact numbers or close to it, but I believe we provided over 30,000 vaccines in Riverside at our facility.
Yes.
And we used a lot of what we had learned, the staff, the entire staff, through this planning and made that happen. So and with a lot of volunteer help.
and that's kind of why we do harvesters every month is to
Good
keep
practice.
that practice and, you know, following the incident command structure and all that type of thing. And because we're giving away food to people, we're tricking staff. They don't see that part of what they're learning, but they see the good they're doing, which everyone likes to do good things. But we're also getting them, and I mentioned using the radio,
Mhm.
directing people. If you notice, our parking lot out here has developed white spots. It's not a rash, it's where every cone goes. So we can, like, if I said, you know, would you forego out and put out the cones? You'd know exactly where to put them and how to string the rope, because those are all labeled, and it'd be up and ready within 30 minutes.
Probably less.
So impressive, some of the things that Dan and his staff are doing.
Okay. Well, it's 12,000. It is what it is. So who wants to make a motion?
I can do that. The Board of Trustees authorizes the director to sign the amendment number 1 to the city's readiness initiative contract with the Missouri Department of Health and Senior Services for the contract period of July 1st, 2024 to June 30th, 2025.
Do we have a second?
A second.
Further discussion? Okay, let's vote. Susan?
Yes.
Kim?
Yes.
Me? Yes. Zach?
Yes.
Okay.
So
So that'll be postponed.
So the next thing is,
Personnel action, right?
actually, I just wanted to mention that the Jackson County. So,
Oh, yeah. First page. Yep.
several health departments have gotten new buildings in the past
I'm
couple
trying
of
to copy it.
One of the buildings is Cass County Health Department got a new building. Jackson County Public Health got a new building, and they are having a open house. We'll have to scroll back and let it memorize it, on June 12th. So if anyone wants to attend, I know Dan and I will both be there. I think Dr. Kingsley, you said.
Yeah, as long as you remind me, because I know I'll forget. And then what's the dress code? Just kind of like how we did ours. Obviously, I'm not gonna wear a suit, but dressy, right?
It's formal.
See more gowns.
So when I saw this, the question I had about this, and this is not to pick on them or anything, but why did they pick Lee Summit?
That's
Jackson, you
yeah.
would think they'd have more downtown or something. Why? Nothing against Lee Summit, and I'm sure it's a great place and all, but Jackson
not
County, you would think it
still
would be
have their-
downtown KC.
So,
Kansas City, Missouri.
so
Ah,
it is separate from, you know, Kansas City Health Department has their own.
okay.
And so this is mainly Eastern Jackson County. They were previously in Independence downtown, which probably was more accessible with mass transit because there's a transit center right there at Nolan Road and Truman Road, which was maybe 4 or 5 blocks away from the health department. Why they decided to move, I'm not sure. They are in a very nice area. It's kind of a
Upscale.
industrial, light industrial business park kind of thing. It's nice, but why they moved away, you know, I don't know. I can't.
So,
answer your
so
question.
tell me how it plays out. So Kansas City Public Health pretty much runs the show. And then anything that's more ancillary, these guys would take care
No.
of?
It's very similar to us. Anything in Kansas City, Missouri proper city limits for certain things, the Kansas City Health Department is going to take care of. So we all have contracts with the state. We all have jurisdiction. So for communicable disease investigations, for food inspections, for certain things that require jurisdiction like those, Kansas City, if it's in Kansas City, Missouri proper, just like we're in Kansas City, Missouri proper, the City of Kansas City Health Department takes care of it. Now, for other things that are not jurisdictional, the people who live in Platte County and Kansas City can go either place. So I understand there may have been a data breach at the City of Kansas City Health Department. So they could not do vital records. We've gotten a huge influx over the past couple of days. Once the directions were clarified, because they were telling them to go to the wrong place. But people who live in Kansas City can go to either place. If it's preventive services, they can come here because they're Platte County residents. Somewhat, they could go to any health department, but they're probably going to come here. So that's the same way how Jackson County is too. So anything outside the limits of Kansas City proper, they take care of. With the exception now of Independence, which also has its own health department again.
Oh, they have one again?
Yes.
When did that?
Maybe 2 years
Oh,
ago,
okay. I'm way behind.
City of Independence.
As their own public health.
So,
Has their own.
and you probably don't know this, Zach, but I was the director of the City of Independence Health Department when the city council and the city manager decided to close the health department. And it is required by their constitution, by their charter. But anyway, for me, I've been there 17 years, so it was shocking that they closed it. But then COVID came and they realized they wanted to have control of what the health department was going to do and of the data. And so they reopened it. But so anything outside of, anything outside of Kansas City, Missouri proper and Independence proper is what Jackson County Health Department takes care of.
All right.
So, and Summit's growing hugely.
Yeah.
So, I mean, it is kind of a population center, whether it's where all the people of need live, you know. You have to, they probably looked at it. I'm not sure how they came up to that.
Okay. Yeah, just remind me so I don't forget when the time comes. It's June. I think I have it, June 12th. I think I have it on my phone anyway.
The last thing is the personnel action, or how do you say Cassie's last name?
Mal,
Is that right, or are you just guessing?
shot in the dark. I'm pretty sure it's what it is. She's never corrected me once on it. Seems appropriate.
Okay, so,
That's right.
do need board approval, for the personnel action to bring Cassie Mal on as the full-time public health nurse 3. Also, who's known as the immunization specialist, effective April 29th.
Do we have a motion for that?
I will make a motion that Cassie Mel be hired or be brought on as public health nurse 3 immunization specialist effective April 29th.
Second?
A second.
Any further discussion? Let's vote. Susan?
Yes.
Okay.
Yes.
Me? Yes.
Yes.
Okay. Is that it for the meeting?
The only thing the only thing I would like to say is, Cindy did text me about Swope's meeting. Karen, the CEO, wants to meet at 3 o'clock that day, so I will send you a reminder.
Yeah. That's fine. Okay, I don't want you to be my personal secretary, but I always like get busy with other stuff and then I forget and then I get all guilty. All that stuff.
I like that.
Feel all guilty. Okay, so the next meeting will be June 20th, 2024, 6 p.m. at the 6 p.m. at the Platte County Health Department. And I think that's it. So do we have a motion to end the meeting?
I move that we end our meeting.
Do we have a second?
I second.
Any further discussion? Okay, Susan?
Yes.
Okay.
Yes.
Me? Yes, Zach?
Yes.
Okay, we are done. Thank you, everybody.
If you're not done.
Jeff- Jeff got
Okay, bye, everyone.
Yes. Don't take my phone, but you may.
Okay.
And then that one, I'm not sure.
Just a board signature on this one?
Yes.
Okay.
For everybody?
No.
No, just one.
Him. You just got your.
Okay.
Then I'll put it.